My name is Shadara Phillips, and I'm an RN and BSN student. And today I'm going to be doing my discussion board 2 video discussion on the respiratory system, assessing the respiratory system, and assessing the cardiovascular and peripheral system. This is my patient today, Alex. Say hey, Alex.
Hey.
Hey. Okay, so first I'm going to I'm going to do the respiratory system first, and so I'm having him turn around. And first thing I'm going to do is I'm going to assess his skin. I'm looking at his skin. He do have some slight blemishes. He has a rash in the middle of his back. Do you have any complaints? Any problems with coughing? Any sputum with blood in it?
No.
Any shortness of breath?
No. Okay.
So next I'm going to touch and assess his skin with the backs of my hand. His skin is warm. I don't, as I'm palpating, I don't feel any masses. Are there any tenderness anything you having? No. No tenderness or pain noted. Okay, and the skin is warm. Now what I'm going to do is I'm going to check for lung expansion. And how I'm going to check for lung expansion is when I'm going to put my hands at an angle under his scapula, and I'm going to ask him to take a couple deep breaths. And when I ask him, when he take that deep breath, my thumbs should come inward towards the spine, okay? All right. He is muscular, so it's all right. Take a deep breath for me. And outward. Another deep breath. And out. Okay, good. Alright, when he exhaled, my thumbs went in, and he exhaled, they went out. Okay? So lung expansion was smooth and even. So now I'm gonna move to the tactile firmness part. So what I'm going to do, Alex, is that I'm going to ask you to say 99. And as I'm asking you to say 99, I'm going to be having my hands on various parts of your back. And I'm checking for vibrations, okay? All right, so ready? Say 99 for me.
99.
99.
99.
Okay.
99.
Again.
99. 99. 99.
Okay, great. So now vibrations are equal bilaterally, and as I went down to this lung basis, they decreased as I got to the basis. So now we're going to move to the percussion portion of the assessment of the respiratory system. Now I'm going to I'm asked Alex to take a couple open mouth deep breaths, and as I percuss, there's indirect and direct percussion. I'm going to do an indirect percussion with my hand over the areas as he's taking those deep breaths. Okay, and I'm checking for resonance. I'm checking for any dullness, flatness, or any adventitious any abnormal sounds. Okay? We're going to start. I'm gonna start right to left. Alright, take a deep breath for me, open mouth. Let it out. Oh, deep breath. Let it out. Deep breath. And 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 out. Okay. So percussion throughout the lung bases, they were resonance. I didn't hear any hyperresonance or dullness or flatness as I assessed, or any timpani as I assessed. Now we're going to get to the auscultation part. Okay, Alex, I'm going to listen to your back with the diaphragm of my stethoscope. It's going to be cold, so you're going to feel a little coldness. Okay? So, as he stated earlier, he said he didn't have any shortness of breath or any coughing. He wasn't coughing up any sputum with blood in it. So, we're going to take a listen to his back. And I'm going to auscultate right to left. breath for me. In and out. 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 Okay. So at the beginning of my auscultation, I heard bronchoversícular sounds up at the top of the bases, and then as I moved lower to the lower bases, they became vesicular in nature. So now we're going to move to me checking for egongphony. This is where I'm have Alex say E as I auscultate over his posterior. If I'm checking for consolidation basically. So Alex, as we're gonna listen to you again, and as I'm listening, and I'm gonna ask you to say E, okay? All right. And I'm going from right to left again. Say E for me.
E. 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 E.
Okay, good. No consolidation was noted. So now I'm going to move to the cardiovascular portion of my assessment. Alex, do you mind turning around for me? Okay, so now we have Alex's beautiful face again. And so now I'm going to assess his face. And basically I'm looking for any swelling, any orbital edema. He do not have any swelling, any bags under the eyes. His face is symmetrical. His anterior posterior diameter, it is symmetrical. His shoulders are symmetrical. While I'm here, I'm also going to go ahead and look at his skin. The skin is appropriate for his race. He has hair on his chest. I don't see any moles or birthmarks anywhere at the moment, but he has one on his belly, but we're looking at the chest. So, per the chest, I don't see anything on his pericardium. Also, now I'm going to look at his neck. So, I'm looking at his neck. I'm going to check for the carotid pulses. I'm going to look for any jugular vein distension. And usually, I'll have the patient in the bed at a 30 to 45 degree angle. But for assessment's sake, we have him standing up, and he should come a little closer for me. So, what I'm doing is at the side, turn to the side for me, huh? All right, good straight. Like this. Okay, so I'm looking to see if I see on either side of his neck, do I see any pulsations? All right. And no pulsations is noted. Now I'm going to turn Alex back around, and I'm going to palpate the carotid artery one at a time with my index and middle finger. Okay, start on the right side. I'm feeling for the thrill. I'm feeling how strong the pulse is. Okay, good. Now going to the left side. Okay, I feel the thrill. And the pulses is bounding. So I would say they're +4 and they're bounding. Next, I'm going to check for a bruit. As I check for the bruit, I'm going to ask Alex to take a deep breath and hold his breath so I can hear the swishing of his carotid arteries. All right, Alex, I'm going to listen to your carotid arteries I'm gonna ask if you take a deep breath and hold it for me. Now I'm gonna do this with the bill of my stethoscope. Take a deep breath and hold it. Okay, release. Oh, I'll do it to the left side. Take a deep breath. Hold it. Okay, release. No bruit was heard at this time. Now, so that means his carotid pulse was 4 plus mounting bilaterally. The thrill was filled. The thrill was noted and no bruit. Okay, now as I continue to go on, I'm looking back at his lips, and I don't see any cyanosis, no blueness, nowhere to his face or any other skin. And now I'm going to his. I'm gonna look at his skin again. Like I said before, I don't see any lifts or tints or masses on the skin. No heaves noted. So now I'm going to assess the patient, assess Alex, ape to man. I'm going to assess his aortic, pulmonic, herbs, and I'm going to pulsate the point of maximal, the PMI. Okay, so starting to my right side, because my pulmonic valve is on my right side.
And the left side.
On my right side. Start with my right side, because my pulmonic is on my right side. I'm feeling at the second intercostal space. I don't feel any tinting, heaves, or masses. And I move over to the left side. Same, I don't feel any masses, tinting, say aortic, pulmonic. Then I move into the tricuspid valve. I'm going to Erb's point. And I'm feeling. Then I'm going to the mitral valve. And then I don't mess up. Cause this is the left side, ain't it?
Yes.
Oh, I'm right. Okay. So okay, I'm now feeling for the mitral valve. Okay. All right, and again, I don't feel any tinning, no heaves, or no masses as I palpate. Next, I'm going to auscultate Alex's pericardium. So I'm going to start with my diaphragm. I'm going to auscultate again with the bell. Okay, so back when I was palpating the PMI, I didn't feel any vibrations or at the moment I didn't feel any vibrations or any tints or masses at the point. So now we're gonna move to listening to him, auscultating. So first I'm gonna auscultate with my diaphragm. I'm gonna go right to left. Aortic, pulmonic. Then we're gonna go to Erb's point. Then tricuspid. Then we'll go to the mitral valve or the apical pulse, which is the point of maximal, the PMI. And we'll listen for that. Okay. And now I'm going to also assess with the bell on my stethoscope. Starting at the right side again. And I started with the aortic, pulmonic, Erb's point, tricuspid, and then we'll end with the PMI, the mitral. Okay. So no abnormal heart sounds or rubs, murmurs noted. So now I'm gonna go back and I'm gonna assess his clavicular, the lymph nodes, his clavicular lymph nodes. I'm feeling they're non-palpable. Any tenderness? No. All right, then I'm gonna open up your arms for me. Now look at his arms. I see his color is inappropriate for his race. It's warm. I don't see any discoloration or any moles. And now while I got the arm open, I'm going to assess for the axillary lymph nodes. So as I'm assessing for the axillary lymph nodes, do you have any pain, tenderness? No. Okay. Now I'm going to move and I'm going to assess for the epitropial lymph nodes. It's at the elbow. I'm assessing those bilaterally, and I don't feel any nodules, and they're palpable. And now I'm going to hold the arms out like this, and I'm going to assess his radial pulses. Right, radial pulse is noted. Oh, radial pulse is noted bilaterally, so you can see, I can show you, they are noted bilaterally, and they are 3+. Okay, next we're going to go to his legs, and we're going to put your leg up for me, and we're going to look, I'm going to assess his lower extremities, and I'm going to have to do one at a time because, you know, I have his legs sitting up. Okay, so first thing first, I'm looking at his lower extremities. He don't have any swelling noted, any discoloration in his skin. We're gonna look at first his I can't pronounce the word. His posterior tibialis pulse, and that's right here. If you can see my hand, and that's the lateral part of his foot. Okay, and I'm gonna check it on his other foot. Yeah, thank you. Good. And they were 3+, and there was bilaterally 3+. And now I'm gonna check the dorsalis pedis, which is at the top of his foot. There we go. Let me check the other foot. And they are also 3+. There are 3+, and they are equal bilaterally. Now I'm going to check for his capillary refill in his toes while I'm up here. Let me check the other one. And the capillary refill is going to be less than 2 seconds. Yes, the toes are blanchable, and it was less than 2 seconds. Let me see your hands, huh? Check his hands. Blanchable, and it was less than 2 seconds. And let's see. That's